Sternoclavicular dislocations are fortunately fairly rare injuries, but those that do happen can cause a lot of pain, sometimes for a long time. Now, most patients don't need surgery, but unfortunately some do. In this video, I'll explain why some of these collarbone injuries need surgery and why others don't. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of the Ask the Doctor video series that I've started based on questions you've left me in the comments to the videos on my channel. And this is a topic and a body part that I get a lot of questions about. This is what's called the sternoclavicular joint between the sternum or the breastbone and the collarbone. You can see it on this model here. It would be right there, that bony prominence. And what typically happens is you get an injury either that drives your arm back, popping the collarbone out in front of the sternum, or you get hit directly on the inside of your collarbone, pressing it backwards behind the sternum. That's not as common as the anterior, but they both can occur. Now, most of them don't need surgery, especially when it pops forward. Yes, you have a prominence there, and that tends to stay, albeit it may get a little less prominent as the swelling goes down, but the pain over a couple of weeks or months typically gets a lot better. There's not typically a lot done for that. There's not really an easy way to push it back in because a lot of times it pops back out, but most people can tolerate the prominence and overcome the pain, get back to full activities with no restrictions. In my experience, there's two groups of people that typically need surgery. One is when it's pushed behind the sternum, and that's because that bone, that collarbone, is now very close to the aorta and the esophagus, very dangerous positions for that collarbone to be. And so that typically requires surgery or a surgical procedure to pull it back in place, or sometimes open it up, pull it back into place, and then reconstruct the ligaments to hold it there. The other group of people that often need surgery for that are ones where the collarbone is popping back and forth and it just drives them bananas. There's not really a non-surgical way to stabilize that. Physical therapy, injections, things like that don't typically work. And in those cases, it's probably going to be some kind of ligament reconstruction using a tendon to basically reconstruct the ligaments that hold the collarbone in position against the sternum and eliminate that motion. Both of those are fairly big surgeries and require not just the surgery, but a long time in rehab. But those are typically the groups. Either one, what's called a posterior dislocation, where it's pushed behind the sternum, or one that involves recurrent instability, where the inside of that collarbone is popping back and forth. Now, if you have an orthopedic injury and you want to hear about options other than surgery or cortisone shots, maybe not for this particular injury, but for other types of injuries, click the link in the description under this video to fill out the contact form to schedule an appointment with me. Also, I'd love to hear your experience with your sternoclavicular or collarbone injury. Leave those in the comments below. Just understand, if you leave a question in the comments, I can't offer you medical advice, but I might answer your question in a future video like this video series. Make sure to subscribe to my channel, click the bell to be notified when I release a new video and when I start a live stream like my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.